Welcome to Innovate and Excel, the ASC Leadership Podcast, where we delve into the minds of visionaries, trailblazers, and leaders in the world of ambulatory surgery. This episode is brought to you by EDM Medical Solutions. In our very first episode of Innovate and Excel, we're talking to an exemplary figure of ASC leadership, Dr. Keith Smith. Dr. Smith is the co-founder, medical director, and CEO of the Surgery Center of Oklahoma. He is a board-certified anesthesiologist in private practice since 1990. In 1997, he co-founded the Surgery Center of Oklahoma, an ASC in Oklahoma City. SCO is owned by over 50 of the top physicians and surgeons in central Oklahoma. The free market focus of the Surgery Center of Oklahoma, the innovator of this free market model in the United States, has gained the endorsement of policymakers and legislators. Dr. Smith is also the co-founder of the Free Market Medical Association. The FMMA provides a platform where buyers, both individuals and employers, who are seeking high-quality, affordable health care, can find free market-minded sellers, both physicians and facilities. Additionally, Dr. Smith has made appearances on The John Stossel Show, CNBC, Huffington Post, The O'Reilly Factor, and more. He has also been featured by Reason Magazine's TV division and NBC affiliate KFOR. The New York Times, ABC News, Forbes, and many others have written articles featuring Dr. Smith's revolutionary approach to healthcare pricing and uncompromising free market principles.
When it comes to your surgery center's medical imaging needs, choosing the right partner makes all the difference. That's why over 2,000 healthcare facilities across the U.S. trust EDM Medical Solutions. As a family-owned and operated company with over 30 years of experience, our dedication to quality and our comprehensive product range ensure that your ASC is equipped with the best tools available. From surgical equipment drapes and probe covers to innovative disinfection solutions, EDM offers everything you need for imaging success. Visit us today at us.edm-imaging.com to learn why so many healthcare facilities choose EDM as their trusted partner for medical imaging supplies. Make the smart choice for your ASC today with EDM, because our mission is to help you enhance patient care.
Price transparency in healthcare continues to be quite the debated topic in the U.S., especially in recent years with newly introduced rules such as the Hospital Price Transparency Rule from CMS that was effective January 1st, 2021. Despite efforts such as these, though, we are still nowhere near the point of offering completely transparent pricing across the board, and patients do find themselves frustrated more often than not. However, there are facilities that have adopted a completely transparent approach to their pricing so that patients can understand how much they're going to pay before they go in. Our guest today is very familiar with this concept, as his own facility was one of the first in the country, actually, to adopt the model. Dr. Keith Smith has been called one of the forefathers of the price transparency movement. He is the co-founder, CEO, and medical director of the Surgery Center of Oklahoma. Additionally, Dr. Smith is the co-founder of the Free Market Medical Association. He has appeared on major TV networks such as CNBC and Fox News, and publications such as the New York Times and Forbes, advocating for a free market approach to healthcare. Dr. Smith, thank you for joining me today.
Thanks for having me.
As I stated in the beginning, there have been strides made towards price transparency in recent years, but I think that a lot of people in healthcare administration would debate how big those strides have actually been. Before we get into the current landscape, though, I think it'd be helpful if you could take us back in time to when you co-founded the Surgery Center of Oklahoma. With transparent pricing in mind, could you just elaborate on your journey to founding your facility and the decision to adopt a free market approach?
You bet. Thanks again for having me. I'm an anesthesiologist in private practice, first and foremost. Started my practice in 1990 and realized early on that patients were being brutalized, victimized financially by the hospitals where I was providing anesthetics. And there really was no way for me to escape being an accomplice, an accessory to those crimes, other than to walk away and start my own facility. So in 1992, the government became extremely heavy-handed through Medicare and price fixing, and they became heavy-handed first with hospital-based physicians, radiologists, anesthesiologists, pathologists, and ER docs. And so the reduction in fees was so draconian that it really got everybody's attention. It forced people like me, who was recruited to Oklahoma City to do cardiac anesthesia, to completely reconsider that decision. So there became shortages where the prices were too low, and there became surpluses where the prices were too high. Medicare got it all wrong, but the government always gets everything wrong. So in around that same time that the physician fee cuts were occurring, several of us noticed that the hospitals where we worked were growing. Their administrative staff was ballooning. There was a crane in front of the ER, building on to every aspect of the hospital, new buildings going up. So the hospitals financially were making out like bandits, like really never before, starting in the early 1990s, while physician fees were being slashed. And so it came to our attention that the patients we were taking care of in the operating room were being aggressively pursued by these same hospitals for bills. So, I grew up in a Christian home that believed in the golden rule and mutually beneficial exchange, and I did not want to be a part of this system that was victimizing patients. We also saw that surgeons were being denied the supplies that were required to perform cases in the best manner. So quality was affected, price was out of control. And so a like-minded anesthesiologist joined with me, and in 1997, we walked out. We walked out of what anyone would consider very lucrative anesthesia practices, and we started Surgery Center of Oklahoma. And we did it so that we could have complete control over the quality and the facility, but also the patient's financial exposure and experience. We swore we'd never take a dime of money from the federal government, and we never have. And we also swore that patients would know up front what they were going to pay us before they arrived. All the insurance companies hated us. We were attacked nonstop by the big hospitals, big insurance companies. And we didn't understand that at the time, but we really didn't care because we got busy real fast. We were out of the network with all the insurance companies. And so I had to really sharpen my pencil and quote prices over the phone to patients, not realizing that what I was quoting over the phone, these bundled all-in, surgeon, anesthesia, facility included prices. I didn't realize how radical that was in 1997, but I also didn't realize the prices I was quoting was less than their in-network deductible. So patients that had insurance were financially better off paying our entire all-inclusive fee than they were actually using their so-called insurance benefit. So we began populating a list very, very early on of all-inclusive prices that could be quoted over the phone. One of the first examples was a woman who needed an excisional breast biopsy, and we quoted $1,900 over the phone. That was surgeon, anesthesia, facility, and pathology. And she told us that the hospital down the street from us, claiming to not make a profit, quoted her $19,000 just for the facility. So after the case was over, you sharpen your pencil and you look hard, and I realized we'd made money. And so this 10-to-1, 8-to-1 ratio became pretty predictable. Whatever we were quoting over the phone was a tenth, typically, or an eighth of what the so-called not-for-profit hospitals were charging for the same thing. You can imagine what happened. We were attacked mercilessly at the State House. There were attempts to put us out of business, too numerous to recount. But we were invariably viewed as we were an underdog, champion of the poor, because suddenly people and families could afford surgery at our facility that they could not afford at one of these greedy hospitals. So that's the background about how we started, why we started. And then, of course, you know what happened in 2009. I basically put all of these prices that we had composed on a website, and then that really sort of changed things. It changed the entire marketplace, I would argue.
Right. Well, that's a great explanation of how you got where you are. Just how broken, so to speak, the system was, and in many ways, I guess, could be argued still is. I want to follow up that though with another question on price transparency. I have a quote here from Cynthia Fisher. She's the founder of Patient Rights Advocate. She says, "As long as hospitals and insurance companies hide their prices, they can charge whatever they want, and they are." This is a sentiment, of course, that is shared by millions of patients who are frustrated with the bills that they get after they go into a facility, and all of a sudden they're hit with a bill much larger than what they thought. So that being said, in your experience, I know you kind of touched on it, but what role do you think that price transparency plays in addressing those issues like price gouging and what some have referred to as excessive profiteering within the healthcare system? Do you feel that price transparency really could have an impact on that?
Well, first of all, Cynthia and I are friends. She loves what we're doing here. It has been a big, just megaphone telling everyone who says that it can't be done, that it has been done by us since 1997. Right. So, you can't have a market of any kind. You cannot have a competitive marketplace unless pricing is visible. I believe that there will always be an imbalance between supply and demand for everything, medical services included. And as long as you have that imbalance between supply and demand, you must have a mechanism for resolving that tension. Is it a bureaucrat? Well, in Canada, they think it's a bureaucrat. In Canada, they have government employees, or in Great Britain, at the National Health Service, there are government employees, bureaucrats, who decide how to match supply and demand. And if you are beyond a certain age, you are just simply not considered for certain procedures like kidney transplant, open heart surgery, knee or joint replacement of any kind. And so they have a bureaucratic way to ration. I prefer and I champion the free market and market competition, because what happens if you allow the market to work, the same thing happens in medical service delivery as happens with televisions and computers and cell phones and everything else we buy. The more market competition that's out there, quality goes up and prices fall. So if you do not have visible pricing, that is a key inherent part of the functioning of any kind of marketplace. So until patients and buyers, self-funded buyers in particular, demand that pricing be visible, then this dysfunctional place, this medical industrial complex, is not going to provide pricing unless they have to. So I think the role of the buyer is important. That the buyer is really the captain of the ship, and I think that when when the self-funded buyers, in particularly the self-funded companies, demand to know upfront, what is the price for this tonsillectomy, for this cholecystectomy, for this knee replacement? Until that happens, I think there will be a real reluctance to provide that pricing for reasons that Cynthia has stated so clearly. But without pricing, you can't have a functioning marketplace. If you have a functioning marketplace, then prices fall and quality goes up. And that's why these big hospital systems fight it. And that's why the federal government defends them from attempts to install market discipline that every other industry in the United States has to endure.
That makes sense. Now, I want to follow that up with, from the patient perspective, though, have you seen that there is a lack of awareness among patients themselves with options such as your facility, for example, an ASC like yours? Have you seen that still, even now, after decades of course, ASCs existing, still there is at times a lack of awareness amongst patients, and their idea is, I have to go to a hospital?
Yeah, I think that's a great question. I think that individuals are actually much, much more aware than institutional buyers. I think that self-funded companies that are institutional buyers are the ones that are mostly unaware. And they're either unaware because they don't care, or they're unaware because the broker or consultant that works with them has pulled the wool over their eyes. Now, that's a big problem in the United States. The gigantic brokerage houses do not want any part of medical claims becoming more reasonable because they make money, they make their commissions on medical claims being unreasonable. I would say the more exposed the buyer is to sticker shock, the more aware they are. Right. So we find individuals that buy from us are either uninsured or they're a member of a cost-sharing ministry or group, or they have one of these horrible Unaffordable Care Act Obamacare plans with an insanely high deductible, and our all-inclusive price is less than their deductible. So these people have sticker shock, particularly in the first quarter of the year where they've not met their deductible. So I would say individuals are actually becoming very aware that pricing is out there, it's available. The market is creating some solutions to help individuals find pricing. There are a lot of platforms that are out there. Not just individual facilities like mine, but platforms that are out there that will help individuals find facilities like mine. And so I think there is a real growing awareness, and it's real problematic for the price gougers. Increasingly, I don't have the tinfoil hat on my head when I posted prices in 2009. It's those who refuse to answer the patient's question, how much is this tonsillectomy going to cost me? They're the ones that are receiving real scrutiny, and it's long overdue.
Right. Now, I'd like to move on to the practical side, because there may be administrators, probably several who are listening to this, and they're not at facilities that have established this model. They don't currently have the price transparency in place. And I think it'd be beneficial to our administrator and physician owner audience if they can have that firsthand account from you. So in practical terms, could you explain what price transparency exactly looks like at the Surgery Center of Oklahoma? To what degree are patients informed of the price breakdown? Is it by line item, or is it more so the cost of the procedure as a whole that they're informed of prior so they know exactly what they're going to pay?
It's another great question. So in 2009, before I launched the website with all of our prices, and we were the first to do that, I imagined myself viewing this website through the lens of a patient. And I realized I was not going to want to write a check to anesthesia, a check to the surgeon, and a check to the facility, and a check to the pathologist. I was going to want to write just one single check. So I formed a clearinghouse. It's called Atlas Billing Company, and there's a bunch of prices there too. I formed this clearinghouse so patients could just write one check. And that infrastructure has made implementation of our creation of bundles and implementing them very, very easy. I actually make Atlas Billing Company available to any facility that wants to jump into this bundled price surgical world until they figure it out on their own, and then they can kick our training wheels off and go do it on their own if they like to. So implementation of these bundles is really pretty straightforward. I start by asking the surgeon how much they think is fair for their fee. And this is a real circle around the campfire kind of kumbaya moment, because if anybody gets greedy, then the bundle price gets too high and no buyers are really interested in it. So everyone has to really kind of behave themselves. The most egregious price gougers typically are on the institutional side. Usually it is the facility that struggles with pricing that is fair. But I ask the surgeon how much they think is fair. Inevitably, the answer I get is a price that I think is too low. Anesthesia has to come up with an idea about what their time is worth. And then the facility has to adopt sort of a time and materials approach like a general contractor. And then it's not algebra. You just add those up. And then whatever you come up with is your price. And if you need to pad it for some uncertainty, then do so. And then go with that. And then after the cases, look it over. If you were right, you're right. If you're wrong, then adjust. Increase the price or lower the price. That's part of what happens in a competitive marketplace. One thing I've encouraged ASC administrators to do that have contacted me is to look at the pricing I have listed on our website and double it, or 1.5, and then figure out who gets what retroactively. That's a good way to start. That's how the Free Market Medical Association started, was where we all teach our competitors how to copy us. And that sounds like something that a greedy capitalist pig would never do. But it's actually very collegial and very cooperative when you get the people under the tent who subscribe to this market discipline like I've described, and they help each other. And I help people copy us all the time. So that's kind of down in the weeds, but that's the nuts and bolts of how to get started and exactly how I did it.
Interesting. That's a really great explanation. I think that really, clears up the concept. Evidently, this is, like I said, a topic that's very debated. You already mentioned how you were met with a lot of opposition in the late 90s when you started. And you, of course, are very involved in advocating for the free market approach with the Free Market Medical Association. So could you tell us a little more about what challenges you faced in advocating for that approach, especially price transparency, and particularly in the face of resistance from industry insiders or lobbyists and maybe even regulatory bodies? Could you tell us a little bit about that over the past few years?
Sure. So to summarize, bird's eye view, the best way to look at it is a Gandhi quote where, first they ignore you, then they laugh at you, then they fight you, then you win. And that's exactly what happened. I launched the website in 2009 and no one even noticed. It's just like a tree that fell in the forest. And then someone did notice, and they started to mock us and make fun of us. There were attempts to impugn the quality of care that was delivered at our facility, because how in the world for $3,740 can you provide a quality knee arthroscopy when the not-for-profit hospital across town is charging $35,000? What corners are they cutting? So the first thing that happened was they started pointing their finger at the horrible quality that must be present at our facility. I anticipated that. And so I published our infection rates online on the website, which are 1/100th or 1/1000th of the national average. In 2012, our actual infection rate was 0. We didn't even have one. And I mean, we do a lot of orthopedics and joint replacements here. So the resistance we received from the industry, from the hospitals, was to, as I've just described, try to impugn our quality. The insurance companies, they didn't really know what to do about us. I think that they were concerned that someone might ask the very inconvenient question, wait a minute, Surgery Center of Oklahoma, I mean, they do a lot of pediatric surgery there. That they know what they're doing. They take care of all the Division I athletes in the state and the Thunder players. I think that's a really good place. And I'm pretty sure they're cheaper than anybody else in the entire region, if not the country. Blue Cross, United, Cigna, Aetna, why aren't you buying from them? Well, those questions are very inconvenient for the insurance carrier, and they work hand in hand with the hospitals. I've had one hospital administrator tell me that he views the carriers as ATM machines for his hospitals. So
Wow.
they work hand in hand, and usually when there's some well-publicized disagreement between a hospital and a carrier, that's mostly theater. Now, that's mostly for people to, think that, they're really struggling and, they're really fighting. They have the buyer's interest at heart at all times, and that's just not true. So the insurance carriers were very frustrated that so much business was coming to Surgery Center of Oklahoma, business that were actually beneficiaries of their insurance plans, but patients paid us directly. So the insurance commissioner in Oklahoma in 2006 allowed the insurance companies to stack deductibles. So what that means is, since we were out of network, patients would just pay us, out of network, but they were not allowed any insurance benefit whatsoever out of network unless they'd already met their in-network deductible. So they stacked deductibles, and that made it very tough for patients to justify coming here. So that's how the insurance companies attacked us. And then there were so many other attacks. There were attempts at the national level to make physician ownership of facilities illegal. There were attempts to install percentages that must be obeyed in terms of where your revenue came from. Like so much has to be Medicare, so much has to be Medicaid, so much has to be uncompensated care. And there were all kinds of attacks like that. And they all backfired. They all backfired until they stacked deductibles. When they stacked deductibles, that hurt us. And that really is what pushed me against the wall and led me to put the prices online.
That makes sense. Now, one follow-up on what you mentioned, one of the first attacks was quality of care. And I'd like to hear how you address the objection from some people where they say, well, the ASC is more dangerous. Don't go to the ASC because if you're in a hospital, you're safer. What if there are complications? They don't have the resources to take care of you. That's an objection that patients sometimes hear. And there's also sometimes, there's been this idea that there's a lack of trust. If my physician refers me to an ASC, is it because they're being compensated? So could you just tell us how you all address those concerns when it comes to complications? Because I think sometimes patients are incorrectly scared, without real basis because of this idea that's been promoted, when we know ASCs are quite safe.
So when the whole idea of ambulatory surgery center hit the radar back in the late 80s, the hospitals went into damage control mode because they saw the writing on the wall. And all they care about is revenue and market share. And they knew this was going to be a problem. So their propaganda teams did a couple of things. They started this, what if something goes wrong narrative? You're not going to be in a hospital where there's a pediatric endocrinologist or a radiation oncologist. You may not have all of the specialty care that you might require. And that was strictly a marketing strategy by the hospitals to mitigate the damage they saw coming. The other thing they did was they started and I got to hand it to them, this has been so wildly successful. They started a poor mouthing narrative where they were going broke. All of these healthy patients that have good insurance are being, deflected away from the hospitals. And so we're going broke and, we have to cost shift and we have to charge everyone more because we have these greedy doctors, who are taking over these facilities. Well, how in the world am I a greedy doctor if I'm charging 1/10 of what this so-called not-for-profit hospital? And everybody needs to know, not-for-profit means don't pay tax. That's all it means. They don't pay any tax. It doesn't mean they're not trying to make a profit. Trust me, at 10x what I charge, they are really working hard to make a profit. So the whole safety narrative originated as a marketing ploy by the hospitals to mitigate the damage they foresaw and correctly foresaw. I make the case that if something goes wrong, you better thank God that you're in an ASC, because the staff to patient ratios in an ASC are so favorable toward quality that we are much more likely to foresee that something is about to go wrong and much better staffed to deal with it than any hospital, because the ratio of staff to patients in a hospital is just frightfully low right now in particular. So I would argue safety-wise, that is a myth. The other thing I'll say is, we don't accept insurance at Surgery Center of Oklahoma. We don't have a single insurance contract. Patients are here because they want to be here. They're not here because they're directed here because we're in network with some insurance carrier. And so over time, you develop a reputation for quality, and that includes a reputation for how do you respond when the very unusual event occurs and something does go wrong. And I'm here to tell you, in Oklahoma and Oklahoma City, anytime a patient has had a perioperative MI or they've had anything like that, there's no better place than Surgery Center of Oklahoma for a patient to be, and everybody knows that. So, facilities that are combating the myth of quality, they just need to be sure that they do a great job, and then over time, the reputation is so solid that they can just laugh at that, like water off a duck's back.
Right. Makes sense. Now to wrap up, when we look back at the last few decades, what are some of the key ways that you'd say this price transparency movement has had a positive impact on the patient experience? What are some key stories you'd like to tell that you could share with our audience that really are the evidence?
One of the most powerful stories is the one I've already mentioned, the woman with the breast mass who paid $1,900 instead of $19,000. We had a patient from Georgia who needed a transurethral resection of his prostate, and our online price all in was $3,600. He went to his urologist in Georgia, and they got a quote from the hospital for $40,000. Again, 10 to 1. And so the patient told his urologist, I'm going to Oklahoma City. Well, it turned out this urologist had lost another patient to us about 2 months before. So they marched over to the hospital, walked into the administrator's office, and the urologist said, you guys are killing me. This will be the second patient I've lost because you're quoting these insane prices. And the administrator said, what was the price in Oklahoma City? He says, $3,600. So they matched our price. Well, the patient reached out to me. He did not come to Oklahoma City. He stayed in Georgia. The patient reached out to me and he said, do you realize you saved me $36,000 and you did not even perform the procedure? And that's the beauty of the market. When I launched the website in 2009, I hoped that would happen. I wanted us to be more visible to those that had sticker shock. I wanted people to be able to use our prices to leverage a better deal, whether they came here or not, really to start a price war. And then I wanted to understand more clearly what are the scams that are at work that keep facilities like mine that are cheaper and better from being completely full of patients. So I can tell individual stories. I can tell institutional stories. Oklahoma County, the largest county in Oklahoma, is a self-funded group. They have 1,100 lives in that group. In the first year they were with us, they saved $3.75 million.
Wow.
So the prices that we made available to them, which are the prices we make available to everyone, we don't do volume discounts. The prices were so reasonable, what they were accustomed paying, that they were able to waive all out of pocket for their employees. So if an employee or a child, a dependent, needed to have tonsillectomy, they could come to Surgery Center of Oklahoma, and Oklahoma County waived all out of pocket for them. So they didn't have this hurdle to care that we call a deductible. And a lot of people can't come up with, whatever deductible is inflicted on them by a carrier. So we would have patients and families come to see us around Christmas time. This happens every year. And they would tell us we were going to have Christmas or we were going to have a tonsillectomy, and we're having both. And it's thanks to this program. And the prices are so reasonable that institutional self-funded buyers are able to waive all out of pocket for the member. This is changing lives. This is making companies financially more healthy. It is allowing individuals and patients to keep the money in their wallet and to, do whatever it is they need to do for their family and their children. This is really life-changing. There are too many stories really to tell since we've been doing this in 1997. But it's very important, and it's the right thing to do. And everybody that works at my facility and those that have modeled us, they love coming to work because this is missional. Ultimately, we are profitable, but we're dealing face to face with patients, not only for their medical needs but also financially advocating for them.
That's wonderful right here. I mean, the work you all are doing is definitely impactful, and just hearing that, I think, is an encouragement to other administrators, other physician owners who perhaps have not yet been able to adopt this approach to really consider it and to see that it can work. So thank you very much again, Dr. Smith, for speaking to us today and just for being such a great voice advocating for the patient and for a more equitable healthcare system.
You're welcome. Thanks for having me.
Thank you for listening to this episode of Innovate and Excel, the ASC Leadership Podcast. Subscribe today on your favorite podcasting app to be notified when new episodes are released. For more information on who we are and what we do, visit our website, us.edm-imaging.com.